Welcome to JB Nursing class. Today in this video we'll discuss in details about the normal heart sound and the abnormal heart sound. So normally normal heart sound, there is two types of normal heart sound. First heart sound, that is love, and second heart sound, that is dove. So then apart from these two normal heart sound, there is two abnormal heart sound also there. This abnormal heart sound are sound 3, the third heart sound, and sound 4 or fourth heart sound. So now we'll discuss about the what is normal heart sound. Normal heart sound or S1, first heart sound, that is love. It is normally produced by closure of AV valve, atrioventricular valve, or tricuspid or bicuspid. So when there is a closure of this atrioventricular, both right and left atrioventricular, right ventricular valve, that is tricuspid, and then left atrioventricular valve, that is mitral valve or bicuspid valve. When there is closure of these two valves simultaneously, that time this first heart sound or love come. Then second heart sound or dove. So normally this heart sound come when there is two semilunar. Semi means half, lunar means moon, half moon shape two valve, that is aortic and pulmonary valve. When this simultaneous closure of these two valves occur, that time second heart sound come. So these two, love and dove, first and second heart sound, are normal. Now what is abnormal heart sound? That is S3 and S4. So third heart sound, also known as ventricular gallop. It corresponds in early ventricular filling, passive filling. When mitral valve opens, it is often associated with heart failure. Normally, this third heart sound often associated with heart failure. Here, what happens means this third heart sound also known as ventricular gallop, because in this what happens means early ventricular filling or passive filling. There is a early ventricular means normally when we should, the filling of ventricle should be there, but feeling early, that is for that reason there is third heart sound come, that is called this heart sound also known as ventricular gallop, often seen in heart failure. Then fourth heart sound. So in fourth heart sound, that is also known as atrial gallop. So third heart sound, ventricular gallop, there is a early feeling or passive feeling, or early ventricular filling or passive filling will be there, not active filling, that is a passive filling and early filling. Usually seen heart failure. This heart sound also also known as ventricular gallop, and fourth heart sound also known as atrial gallop. Now we will discuss about blood vessels. Arteries and veins have three layers. So layer of blood vessels, in the layer of blood vessel, we'll discuss later in the next video about the vessels and the layer of blood vessel, the thickest layer of arteries and thickest layer of vein. We'll discuss in this video.